something called the Child Care and Protection Act, which was enacted in 2004, which makes it an offense to sell a child tobacco. And it's also an offense for a child to work in an establishment where they sell tobacco.
Or to purchase.
To purchase. So but it's also to sell. So what we need to do is to have that law enforced, because there is a law. Yes. Yes.
Why is it that
right.
they are the guy or the person selling actually give them?
Yes.
Because then again, there's a sign that says it shouldn't be sold to minors.
It should not be sold.
They are not going,
no.
In real relation to that.
It needs to be enforced. There is a law, so that is another on the to-do list of the government of Jamaica, to enforce that law. You know what would happen if one person get arrested for selling to a child? That's all you need, you know.
Yeah.
One person on the 7 o'clock news going into the police station. Because it's not fair. The children should not. No, there was a study done, I think, by the National Council on Drug Abuse a couple years ago, where they dressed 5 children in school uniform and sent them to several places. And in everywhere but one, they were able to buy the cigarettes. And then they went to the owners and said, how did you... Oh, well, I thought it was for the uncle, or I thought it was for the father. But I think the enforcement would also help.
But I think, though, the enforcement, this new ban, it will take... for me, it will take a longer time than we think. Because, you know, once Jamaicans adapt to something, it's hard for them to break out of that. You know, that thing. Because a child coming to me to buy a cigarette, I usually sell them because I don't know if it's the uncle or the mother, and I want the sale. You understand what I'm saying?
Exactly.
So that is a hard enforcement for some people in Jamaica, and it will take a longer time to get down the statistic, the numbers of smoking and things.
I think the sensitization, which is what Alicia was saying yesterday, more sensitization and sharing the information, especially with the youth, and that's why I applaud you in this program, and I applaud you for addressing this issue. Because if the young people listen to this, you know, if we can get one less person starting or one person to stop, then we have started our goal.
I'm glad you said sensitization. Working as a project manager at Tobacco and working in Heart Foundation, what are some of the activities that, you know, you put out there to charge young people to be aware of the effects of cigarette smoking?
The project that we were on was specifically really working with the government to help them to pass the law. So a lot of the sensitization we did was with policymakers, government ministries, faith-based organizations, and so on. The Heart Foundation actually has a program in schools where they do something called a Healthy Club, Healthy Heart Club. So that message goes through, and I know the Jamaica Cancer Society has done quite some work too with young people on Kick Butts Day and anti-cancer, anti-tobacco forum that's done every year for young people. The last one in February was 350 children from 18 schools right across Jamaica. You know, so the sensitization that we have done is mostly, as I said, you know, with policymakers. And you'd be surprised, I'd say 80% of the time when we present on tobacco, its ill effects, the world framework on tobacco control that Jamaica has signed to, many people said they didn't know. Most of the people, when we finished that PowerPoint, they're like, what? People did not understand the health effect. Everybody knows lung cancer. Lung cancer is one tiny area. There's so many other areas.
Yeah, that's true. Like emphysema, bronchitis, and so many others, respiratory illnesses. But you mentioned sensitization, and Tashai mentioned the fact that it's going to be difficult for Jamaicans to tap in to this new ban. I think once we know our rights, because that's the thing, we need to know our rights as people. We need to know that this is my space, and no one should tamper with my space. This is my corner, and I want to be free from cigarette smoke. And sessions like these will let people know that, listen, you have the right for a free cigarette smoke zone. So once we know that, it will be fine. We can call the police and say, listen, this person is smoking in my space. I'm not in accordance with this, and I want you to do something about it. So it all has to do with the rights of you. What are your rights? What are your beliefs? Stand up for what you believe in. And those succumb to these things, this pressure, because I think that this ban will be better for Jamaicans. You know, couple years from now, people can say, oh, Jamaica, we had made this big step, and people
And
start
it's a big step.
Yeah, it's a big step, and people start appreciating Jamaica for who Jamaica really is. I think too many times we get lackadaisical on certain things. I think we should stand up for our right and know that the onus is on us to let people know that they're not supposed to tamper with our space.
Yes. Well, you want to say
Yes.
something, Miss Mama?
At the Heart Foundation, we did a public opinion poll in December 2011 with over 1,000 persons from 7 parishes. And what we found that over 90% strongly agree that employers and workers have the right to an environment free of tobacco smoke. And also 98% endorsed smoking, ban smoking in all the health facilities and all offices and so on. Now this group of people was made up of smokers and non-smokers. So the public support from adults is very good, and as I mentioned in the youth survey, 70% of them think that banning smoking in public places is a good idea. So I think you'll get good support. You're going to have upheaval, and you're going to have confusion for a while until the clarification of a public space, a workplace, and how the laws are going to be manifest.
Yes.
But I believe a lot of it will be self-enforcing. And so I can say to you, please, don't smoke near me. Go outside. Because we're not stopping people from smoking. Yes, it's going to be a little more difficult.
These big parties and all of those things. I'm just imagining what's going to take place at those, especially summer now. And we're going to see a lot of summer parties coming out there.
But once it's an enclosed place or once it's a public place, smoking is banned. So they would have to have a separate section maybe at the back of the party or somewhere where they're at least away from the general.
Yeah, but I mean, it's smoking, it's going to be in the air, it's going to diffuse in the air anyway.
Just like burning bush.
So I mean, second-hand smoking is there at the same time, but we're just looking at reduction of it.
And it's a process, as you rightly say. It's not going to be, it's going to take a little time. So we're going to start with the more easier enforceable and the more easier to see. And then we move our way down. But remember, 170 countries have signed the framework. Over 100 countries have smoke-free laws. And they're already working. So it's not like we're the only people.
Yes.
And I told you, Barbados and Trinidad have smoke-free laws. Suriname just passed their law in February of this year. Now in Barbados, they have had, again, a little upheaval at first, but there has been compliance after that.
Yeah, and we are seeing that persons there are not dying from respiratory illnesses as in Jamaica and other countries.
There's a reduced burden on the hospital services.
Yeah. So I think it can work.
It can work.
It can.
I mean, it won't be perfect.
Over time, it will fit in. And with all of that say, we have some facts here. Did you know segment? Mr. Engineer Owen, did you know?